Spine fracture or vertebral fracture in old age. You have suffered a back fracture or a backbone fracture. What does that mean? So normally there are vertebrae in the bone like this. So these vertebrae normally they are stacked over each other. Now whenever there is any trauma or injury, or sometimes maybe because of just osteoporosis, there is a fracture in the spine. So if there is a fracture in the spine, first of all it is important to know that not all spine fractures require surgery. Most of them can be treated by just rest, brace and supplements. So if you are suffering from spine fracture and you have done your X-ray or MRI, see your doctor, and based upon the extent of injury, he will advise you either rest or a brace like this, which is known as the Taylor's brace, or calcium and vitamin D supplements, high protein diet, and of course you should stop having alcohol or cigarette. Normally, majority of these spine fractures, almost 95% of the spine fractures, they just heal with proper brace, rest, medicines, supplements, and over a period of time the person can get back to normal activities. However, if there is a special situation like burst fracture or an unstable fracture, or if the compression is more than 30 degrees and there is pressure on the nerves. Now, if there is pressure on the nerves in the spine, then there might be a radiating pain going down the leg, or numbness or tingling, or weakness in the leg, or problem in controlling motion or urine. In such situations, when there is pressure over the spinal nerve, then only surgery is required. So in that situation, if the pressure is too much, sometimes we do a surgery which is known as spinal decompression and fixation surgery, in which we open up the nerves and we fix the spine to take away the pressure from the nerves. Or if the pressure is not too much and the patient is going into kyphosis. Kyphosis means the posture of the body is also getting compromised. Then sometimes we do procedures like vertebroplasty or kyphoplasty. In that, through a minimally invasive procedure, through a needle, we inject cement into the fractured bone to stabilize the bone. Now, this is a procedure which is done under local anesthesia, and normally it is a daycare procedure and the patient can be discharged on the same day. So if you are suffering from spinal fracture, don't worry. Visit your doctor who will advise you the treatment whether based on what your MRI shows and what are your symptoms. And in majority of the cases, it can be treated by just rest, proper medicines, high protein diet, calcium vitamin D supplements, medicines for improving your bone strength, and of course you should stop having alcohol and cigarette. Thank you.